Hello everybody, I'm Dr. Stephen Cain. I help people with peripheral neuropathy get out of pain and back to doing the things that they love doing. One of the ways that I help is by providing you with this educational video series that gives you tips to help give you some much needed relief. This particular video is about understanding on a cellular level where your neuropathy is. Because when you do this, you can leverage that information to better understand what's causing your neuropathy. And when you know that, then you are truly empowered to heal yourself. Alright, so this video is going to talk about, first off, the part of the nerve cell that can be affected by neuropathy, and then the different types of nerve cells that can be affected by neuropathy. So first off, the part of the nerve cell that can be affected. Well, nerve cells are referred to as neurons. Now within each neuron is an axon. This is the long part of the neuron that conducts a signal. Now when this part is affected, this is referred to as an axonal neuropathy. Now around this axon, surrounding it, is a myelin sheath. This is a fatty substance that helps speed up the conduction velocity of that signal transmitted via the axon. Now when this myelin sheath is affected by neuropathy, this is called a demyelinating neuropathy. And when both are affected, both the axon and the myelin sheath, this is referred to as a mixed neuropathy. Now one of the best ways to determine if your neuropathy is demyelinating, axonal, or mixed is to get a nerve conduction study done. This is a simple outpatient procedure where they take 2 electrodes, place it along the course of one nerve in your body. One electrode sends a signal, this second electrode records both the strength of the signal and the speed of it. And in the interpretation, you can figure out if this is slowed down and or if the strength of the signal is compromised. If it is slowed down only, then this would imply a demyelinating neuropathy. If the strength of the signal only is compromised, this would imply an axonal neuropathy. And if both of them were compromised, then this would imply a mixed neuropathy. Now there are more nuances to the interpretation of these tests, but generally speaking, this is how it works. Now there is a caveat. This nerve conduction study only works on the large nerves in your body. So if some of the smaller ones are affected but the large ones are not, then you could potentially get a false negative for one of these neuropathies by only testing these large nerves in one of these nerve conduction studies. Alright, let's go ahead and transition into discussing the different types of neurons that we have in our peripheral nervous system. We have sensory neurons, motor neurons, and autonomic neurons, and any one or combination of these can be affected by a peripheral neuropathy. The sensory neurons, these send sensory information from our body up to our brain. Hence, if we have a neuropathy affecting our sensory neurons, then there will be changes, so we might feel more tingling in our body, we might feel burning or more pain. We can also feel a lack of sensation and numbness. For the motor neurons, these go from our brain down to our body to our muscles, and these allow us to contract our muscles and move. Hence, if a neuropathy is affecting our motor neurons, then we will experience weakness. We can also experience muscle fasciculations or muscle cramps. Thirdly, the autonomic neurons, these things are automatically controlled within our body, so it's not a conscious thing that we do. So if these neurons are being affected by a neuropathy, then we could experience things such as erectile dysfunction or constipation or changes in our sweat patterns. Again, you can have any combination or just one of these different types of neurons being affected by a neuropathy. Once you figure out which types of neurons are being affected by your neuropathy, as well as which part of the neuron in the axon or the myelin sheath or both. Once you have this information, you can compile it and leverage it to better figure out what is causing your neuropathy. So how do you do that? Well, there is a wonderful article right here, Peripheral Neuropathy Differential Diagnosis and Management. It's done by quite a few neurologists at Michigan State University. They do a marvelous job breaking down based off what types of neurons and what parts of the neurons are being affected, what the different potential causes may be. In this article, they go into a lot more detail in terms of figuring out what may be causing your neuropathy. I highly recommend that you read through this article. I'll leave a link in the description down below. Ladies and gentlemen, continue to educate yourself, and in time, if you apply what you learn, you will have yourself feeling better, and that means a lot to me to help make that happen. Thank you for watching, everyone. I'll see you in the next video.